mechanics, how it kind of works. But basically, the first thing that needs to happen is that heel strike, which you can kind of do, but you can't like do a full good heel strike because that'll lock that that talus won't lock in properly. Your ligaments seem to be okay for the most part. I'm sure there's gonna be some things that I discover.
Wow, that's neat.
Trying to show you some cool
Very
stuff.
cool.
Yeah, right. So basically, here's that talus.
Okay.
And in this case, I believe that your talus in your right foot is kind of pulled in that direction, kind of slid out anteriorly. So if we kind of look at it from the side, I'm gonna try to superimpose it so you don't see it.
Very neat.
So I think what's happening is it's kind of like stuck a little bit out that direction. We need to kind of shove it this direction. So the talus kind of locks in place before it allows everything else to move. So basically when you heel strike, you kind of lock the calcaneus down. The calcaneus locks into place, right? A little bit into this position, right? Down here. And then on top of that, then essentially everything else can lock into place as well. So when that can lock into place here, then you allow the navicular, which is like the keystone of that arch here, this gets to drop down.
Okay.
When that drops down, the cuneiforms get to slide laterally and widen that foot in that sense.
Okay.
And in your case, I don't think any of that stuff can really happen properly, and you can't really go through that full cycle because of the impingement pain that you have. If you had, and I've had this happen before, like some people, like impingement, where there was like arthritic changes in this ankle mortise joint, where like you can kind of see that, you can kind of see this right now, there's a little space there.
Yeah.
Imagine like a little arthritis going on there, like where it was kind of like buttoned up in there, and
Yeah.
like, I've seen it a couple of times, and some guys, this one guy in particular, when he can run, he can't walk. He's actually a door-to-door salesman. He can't walk. He'll jog from door to door.
Really?
And he can run and sprint and play basketball
Wow.
because of the ankle. Because of the ankle mortise joint doesn't allow for that extension. So if you told me, which you already did, CT, MRI, X-ray, this, that, the other thing has been, negative,
Yeah.
that's a great thing,
Yeah.
because then I'm not really worried about like kind of shoving that thing into the bone. I can be a little bit more aggressive in a nice way.
Awesome.
And I could at least say we tried.
Yes.
But if you were like, hey, there's arthritic in there, and like I can try the manipulation, but it may not help.
Yeah, no arthritis, which is good.
The extensors, as I tested you on a lot of them, the extensor hallucis, as well as the extensor digitorum, those things were definitely weak. Kind of the tibialis anterior, a little bit weak as well. I mean, all your extensors. What was really very weak as well was the peroneus longus and brevis there. What's really unique about the peroneus longus and brevis as well is that the longus, more importantly, if we look at the bottom of the foot, it does attach to the bottom of the foot. Let me just show you. Come on.
This is very cool.
Trying. So when we see it, how it attaches to the bottom of the foot, what that does, it actually helps, since it does kind of attach to some of the cuneiforms, right? It helps to kind of lock that arch into place, and it helps actually prevent that it helps to pronate it. So by you activating this longus, it actually helps to pronate that foot and lock it into place as well. And you can't do that because you stay on this lateral side because you just don't want to do that.
It hurts to go.
Because when you do that,
inside.
you really have to add that pressure into that.
Yeah.
So if anything is the weakest, it's this.
Okay. And
I don't expect this to come back until we can get the other thing to come back.
Okay.
But muscularly, it seems like you're pretty strong.
Yeah.
It's just like it's been going on a while,
Yeah,
so there's a
it's
lot
really
of
tight.
compensation. I bet you if we kind of like
that one's here, right?
it actually attaches under here, dives across the bottom of the foot, and then comes up to the lateral here.
Okay. Yeah, most of the pain just like sits on the left side.
it could be some peroneus tertius too, and the extensor brevis, but and then you have like the peroneus, brevis that helps kind of like pull this foot up a little bit and kind of lock it in a little bit as well, but not nearly as much as the longest does.
What muscle goes? Is there a muscle right
Yeah, that's the extensor digitorum and the brevis as well, as we just showed there. So the extensor digitorum brevis, and there's the longest, which are those. So, but these things have to pull upward, right? The foot has to drive up in order for that to happen, the talus will have to sit and slide backwards to help allow that. That would be like me locking your wrist in and saying, let's pull your wrist up. Okay, now we have to drive those carpals back, and then that can come up.
I gotcha.
It's the same type of thing.
So when I do, like if I just have my foot here and I pull this way, that is